In this session, we're going to look at some case examples of the brainstem auditory evoked potential. We'll start with some examples of normal brainstem auditory evoked potentials. And as you'll remember, the brainstem auditory evoked potential is mature by about 2 years of age. And so these are examples in older children that are normal. This is a recording from a 13-year-old boy. And so we'll see the tracing of the left ear and then also from the right ear. So in each panel for the left ear, the top tracing is the ipsilateral or stimulated ear, in this case the left ear, relative to CZ. The second tracing in the panel is the opposite ear, the right ear relative to CZ, and then the bottom tracing in the left panel is the left ear relative to the right ear, or the ipsilateral ear relative to the contralateral ear. Moving to the right panel for the right ear, the top tracing again is ipsilateral ear, in this case the right ear relative to CZ. The middle tracing is the contralateral ear relative to CZ, and the bottom tracing is the right ear relative to the left ear, or the ipsilateral ear relative to the contralateral ear. So starting with the top, the ipsilateral tracings, you'll see there's a very beautiful 1, 2, 3, 4, 5 waveform morphology. And so this is quite lovely. Recall that only the 1, 3, 5s are obligatory, and so it's nice that we see the 2 and 4. And in this case, it's not labeled, but you can also see a 6 and a 7 in these waveforms. Now, in the middle tracings for both of them, when you look at the contralateral ear relative to CZ, the waveform that is most prominent is the wave 5. And so you will see in both cases, the wave 5 is very clear, as well as the wave 4, 3, and 2. Moving down to the lowest, the bottom tracing in each panel, this is the ipsilateral ear relative to contralateral ear. The waveform that is most clear is the wave 1, and so we see that in all of these cases. Now, going down to the bottom part and the upper limits of normal, you'll note that this is recorded at 70 decibels. And the technologist has placed in the latencies for each of the waveforms. And so scanning across, you'll see that each of the waveforms are below the typed numbers, which are the upper limits of normal. And so because they're lower than the typed numbers, all the waveforms are normal. And then moving to the right side, the IPL, this is the interpeak latency. You'll see that the interpeak latency for 1, 3, which looks at lower brainstem conduction. There's also an IPL for 3.5, which looks at upper brainstem conduction. And then there's an IPL for 1.5, which is the overall brainstem conduction. And again, you'll see that the written numbers are all below, they're all lower than the typed numbers, meaning the interpeak latency interpeak latency is also normal. This is the ABR for an 8-year-old girl. And you'll see the left ear recording and the right ear recording. And you might be thrown off a little bit by the large artifact that's present in both of these recordings. But what should be noticed is that the actual ABR itself, because it's early, looks fine. And so the presence of the late artifact does not actually impact our ability to interpret this recording. And so starting with the left ear and the top tracing, we see a very clear 1, 3, and 5. The 2 is observable, but the 4 is not so clear. Moving down to the middle tracing for the left ear, we see a very clear 5. It's the largest response, and that's the wave 5. And then moving down to the bottom tracing, we see a very clear wave 1. So this is a very normal morphology. When we go to the right ear, we see a clear 1, 2, 3, and then this is an example where the 4 and 5 are merged. And so the 4 and 5 actually form a plateau. And so it might be difficult to identify which is the 4 and which is the 5. And so it's helpful to go to the middle tracing where the wave 5 is most prominent. And so by looking at the wave 5, which is most prominent in the middle tracing, we can sort of track back up and identify the back end of the plateau, and the top tracing is the wave 5. And then again, the wave 1 is observable in the bottom tracing. And going down to our numbers, The technologist has filled in for us in the handwriting that this is recorded at 70 decibels for the right ear and also for the left ear. And then scanning across the numbers for waves 1, 2, 3, 4, 5, we see that the written numbers are all lower than the typed numbers, which are the upper limits of normal. And so the absolute latencies of the 135s are all normal. Moving to the right, the interpeak latencies, we will notice that the difference between the 1 and the 3, the difference between the 3 and the 5, and the 1 and the 5 have all been written down for us. And these numbers are all below the typed numbers, are all lower than the typed values. And so therefore, the interpeak latencies are also normal. This is a recording from a 4-year-old girl. And so this is an example of what happens when we change the decibel level. So both of the panels that you see here are recorded from the right ear, but the left panel is at 70 decibels and the right panel is at 80 decibels. And so for the 70 decibel panel, you'll notice that in the top tracing, the waveforms are not that reproducible in that they don't land on top of each other so nicely. And so the tech has gone on to re-record this at 80 decibels, and you'll notice that the reproducibility is quite nice in the 80 decibel recording. And so the values for 1, 3, and 5 are all recorded at the 80 decibel. So it should be noted that when recordings are done at 80 decibels, the absolute values are not really usable because the absolute values are all calculated at 70 decibels. And so because it's louder, the values will always be lower, they'll always be faster than at the 70 decibel level. And so if you do see a delay at 80 decibels compared to the typed numbers, then it's a very, very prominent delay. But most often we will see that at 80 decibels, the values that are written for the absolute values of 135 are substantially lower than what we see at 70 decibels. So what's important when we look at recording at 80 decibels, if we're going to use the 80 decibel tracings to do our interpretation, we are most interested in the interpeak latencies because those will not change regardless of the decibel level that we are recording at. And so here, the 1.3 interpeak latency is at upper limits of normal. Okay, so it's 2.4 and the upper limits of normal are 2.4. The 3.5 and the 1.5 are all below the upper limits of normal. And so this would be interpreted as possibly normal or even mildly abnormal because it's right at the upper limits of normal, and our upper limits of normal are calculated at the 99th percentile. And so that means this patient's interpeak latency for the 1.3 is already at the 99th percentile. So this may or may not be flagged depending on the clinical picture. You should also recall that over 2 years of age, there's a sex difference in the upper limits of normal values between boys and girls. And so this is a 4-year-old boy, and so you'll notice in our values at the bottom, we're using the upper limits of normal for males 2 years plus. If this were a girl, then we'd have to pull the page. That's for females. We're now going to look at some examples of brainstem auditory evoked potentials in children less than 2 years of age. So recall that the wave 1 reaches maturity at about 6 months, and the wave 5 reaches maturity at about 2 years of age. This is a brainstem auditory evoked potential in a 7-month-old boy. And so immediately you'll notice that the wave 1 is very well formed and clear in both ears, and that's because the wave 1 is mature at this age. And so it may look like the wave 3 and 5 are not as well formed, and that is the case, but it's acceptable because the wave 5 in particular is not mature at this young age. And so as long as we can see something that would suggest a wave 5, and especially if it's confirmed in the second tracing, the contralateral ear to CZ tracing. If we can confirm a wave 5, then we will trust that it's a wave 5. And so in this case, we have selected the 1, 3, 5 in the left ear and a 1, 2, 3, 4, 5 in the right ear. And the numbers are placed in the chart at the bottom. And you'll just notice that the chart at the bottom is upper limits of normal from 3 months on up. And so this is a 7-month-old boy, and so this is appropriate for this age. And so just scanning across the numbers, they look normal. They're below the numbers that are typed, and so this is a normal study in this 7-month-old boy. This is a brainstem auditory evoked potential in a 3-month-old girl. And so what you'll recall is that at 3 months, the brainstem auditory evoked potential is not yet mature, and so the waveform is not as well formed, it's not as well delineated, and it's of much lower amplitude. And so that is perfectly fine and perfectly normal for this age. And so when we look at these waveforms, there's one panel for the left ear and one panel for the right ear. What you'll notice is that the top tracing is recorded at 70 decibels, and the technologist has noted that the waveform is not that clear, and so they've gone on ahead and measured this again at 90 decibels. And so the second tracing is a 90 decibel recording, and you'll see that the waveform is much more clear. And so it's easier to identify the waves 1, 3, and 5, which are our peaks of interest. And so for the left panel, there are 6 sets of tracings. The first 2 are the ipsilateral to CZ recording at 70 and 90 dB. The tracings 3 and 4 are contralateral ear to CZ, again at 70 and 90 dB. And then tracings 5 and 6 are ipsilateral to contralateral ear at 70 and 90 dB. And so we're going to use tracing 2 for both the left and right ears because it shows the clearest waveforms. And so this is recorded at 90 decibels. And so looking at both the left and right ears, we can see very nicely formed waves 1, 3, and 5 in both the ears. And so moving down to our upper limits of normal, we'll notice that the tech has written down the absolute values for 1, 2, 3, and 5 at 90 decibels. And I just want to remind you that these numbers are not relevant to us now because the upper limits of normal for the absolute values are measured at 70 dB. And so because this is measured at 90 dB, they will all be lower than the 70 dB numbers, and so they will look normal, although we don't really know. And so if we really want to know about hearing, we need to look at the wave 1 values at 70 dB. But what is of interest to us are the interpeak latency values, because regardless of the decibel level that the recording is conducted at, the upper limits of normal for the IPLs are consistent. And so even at 90 dBs, we can still use the 1.3, 3.5, and 1.5 upper limits of normal values. And so when we look at these numbers, we'll notice that the 1.3 numbers are normal, the 3.5 numbers are normal, but the 1.5 numbers, the one for the right ear is above our upper limits of normal. And so this would suggest to us that there's a 1.5 an overall brainstem delay that we are able to observe in the right ear. And so this would be an abnormal study with increased interpeak latency between waves 1 to 5, suggestive of a brainstem delay. This is a brainstem auditory evoked potential in a 3-day-old baby boy. And so at 3 days old, the waveforms are very immature, and sometimes it's difficult to identify the waveforms of interest. And so the first thing to note is that the technologist has done this recording at 80 decibels. There's a little 80 written beside it. Most likely at 70 decibels, the waveforms were just not observable. But these are pretty reasonable looking waveforms for 80 decibels in a baby. And so we can see a clear wave 1 and 3 in the left ear, and the wave 5 is not so well formed. And so this might be okay. It's hard to say, but the wave 5 is immature at this age. On the right ear, though, the 1, 2, 3, and 5 are all very clearly formed. And so it's nice. We can identify our waveforms. Coming down to the numbers, again, a reminder that the absolute values are not useful at this point because we're looking at 80 decibel recordings when our upper limits of normal are at 70. But what's important are the interpeak latencies. And so looking at the 1-3 interpeak latencies, we'll see that the written numbers are below the upper limits of normal. So the 1-3 conduction is fine. The 3-5 numbers, however, for the right ear, it's slightly above. It's 2.7, which is slightly higher than the 2.6 upper limit of normal. So that would make it abnormal. And then our 1-5 are below, and so those are normal. And so overall, this would suggest that there's a 3-5 interpeak latency conduction delay in this baby, suggestive of a possible upper brainstem dysfunction. The following are a series of studies where the clinical question was to query hearing. This is a brainstem auditory evoked potential in a 6-day-old baby girl. Now we're told right off that these recordings are done in quiet sleep, which is a really useful piece of information for us to receive. When we see recordings that are this poor, where we can't really see waveforms, one of our first questions is about the quality of the recording and whether the baby was moving and crying. And that would affect the quality of the recording. But with the technologist telling us that this is in quiet sleep, we know that the baby's condition was quiet, and so it's probably not due to artifacts. And so the absence of waveforms in these tracings is probably due to a real clinical problem. And so another important piece of information that we see on these tracings are the numbers 90 for the left ear and then 80 and 90 on the right ear. And so what this tells us is that the technologist probably started on the right ear with 80 decibel stimulation and saw nothing. And so they only did one recording, and then they moved immediately up to 90 decibels and did 2 replications, and again there was nothing, and so they stopped there. Then they moved to the left ear, starting immediately at 90 decibels, and there's possibly a wave 1, but it's very, very poor. And so they did several replications at this decibel level, and so we might possibly be able to identify a wave 1, 3, and 5. Coming down to the numbers, the technologist has written down the numbers for the left ear, which is appropriate to do, but there are no numbers for the right ear. And so the interpretation of this is that there is probably a hearing problem because there's no wave 1. And so when there's no clear wave 1 or a very poor wave 1, it's very difficult to interpret the other waveforms and to interpret interpeak latency. And so from this study, our overall interpretation would be an abnormal SETI query hearing due to absent or poor wave 1. This is a brainstem auditory evoked potential in a 19-month-old girl. In the left panel, you'll see 6 tracings, and in the right panel, there are 9. And so the numbers aren't there, but what it means is that in the left panel, these were recorded at 70 and 80 decibel, and then on the right ear panel, it's recorded at 70, 80, and 90 decibels. And so starting on the left ear, we'll see the 70 decibel recording with a fairly clear 135, and then repeated for the 80 dB with a very clear 135. And then on the right ear, the 70 decibel recording is very poor and not reproducible. And then the 80 dB is still quite poor with a much clearer 90 dB recording, but we can see the 135. And so the technologist has written for us the numbers for the waves 1, 3, and 5, as well as the interpeak latency numbers. Now, I have been saying all along that when we aren't recording at 70 dB, we can't use the absolute value, the absolute latencies, and interpret them. But in this case, we are going to use them because the recording is done at 80 decibels, and the values for the wave 1 are higher than our upper limits of normal. And we know that when we use a louder stimulus, the values for the wave 1 should decrease. And so we expect that if there was normal hearing in this child, that the number for the wave 1 would be well below 2.4. And in this case, for both ears, the number is well above 2.4. And so we can say that there's a very significantly delayed wave 1, suggesting of a hearing deficit in both ears. This is a brainstem auditory evoked potential from a 13-year-old girl. And so you'll see the right ear and the left ear panels recorded at 70 decibels. And so what is striking immediately from these is the amplitude differential between wave 1 and wave 5 in both ears. The wave 5 is of a normal amplitude, whereas the wave 1 is much, much smaller than the wave 5, more than 50% smaller than the wave 5. Now, in a normal recording, the waves 1, 3, and 5 should all be approximately the same amplitude. And so this amplitude differential, where the wave 1 is more than 50% smaller than the wave 5, is clinically important. And when we see this pattern, it typically indicates a sensory neural hearing loss in the ear that shows this pattern. And so in this case, although the latencies, which we see at the bottom, are all within the upper limits of normal or at the upper limits of normal, the presence of this 1-5 amplitude differential would suggest a sensory neural hearing deficit for this patient. We're now going to look at an example of how we can use the brainstem auditory evoked potential to measure hearing thresholds. This is a brainstem auditory evoked potential in a 10-year-old boy. Looking at the left ear panel and the right ear panel, we notice that there are recordings in the left ear at 80 and 90 decibels, and recordings in the right ear at 70, 80, and 90 decibels. What catches our attention immediately is the amplitude differential between the wave 1 and 5 on both the left and right ear at the lowest decibel level. So at 80 dB in the left ear, the 1 is very low amplitude compared to the 5. And then on the right ear at 70 dB, the 1 is very low amplitude compared to the 5. And this is also pretty observable at 80 decibels. And so the technologists went to higher stimulation levels. And so we see a 90 dB recording on the left and 80 and 90 dBs on the right. And at the loudest stimulation, there's very clear waveforms. There is a 1, 3, and 5 that's observed, and the tech is able to give us numbers for the latencies of the waves 1, 3, and 5 at 90 dB in our chart below. And so looking at these numbers, it does look like brainstem conduction is normal because our interpeak latencies were all normal. But what is abnormal in these recordings is that 1-5 amplitude differential, so that the fact that the wave 1 is 50% smaller than the wave 5 flags us to the possibility of a sensory neural hearing deficit. And this differential of the 1 and 5 amplitude is much more pronounced in the left ear than the right ear. Ideally, when there's a question of query hearing, the patient is referred to audiology. In audiology, they do hearing tests at many different dB levels and also many different frequencies. And so the outcome of that test is a fuller picture of the hearing for that patient. But if a quick hearing threshold is required, it can be done in the EP lab, and there's a protocol on the machine that's called hearing thresholds. And so that presents the stimuli at a very, very fast rate, and the technologist just needs to adjust the decibel level of stimulation systematically. And the recording that's obtained is what we see in this image. And so initially, the patient is tested at a very loud decibel level, and then the decibel level is decreased by 10 dB with each recording. And what happens is that the waveforms within the evoked potential get smaller. They become of lower amplitude as stimulus intensity decreases. So the softer the stimuli, the smaller the responses. And the wave 5 is the last waveform to disappear, to become so small that it's not observable. And when this happens, that is the threshold of hearing. And so when the stimulation is decreased, when it becomes softer, the waveforms become smaller and they also become slightly later. And so we can see in this picture at the loudest stimulation level at 80 dB, we see a very clear wave 5. And then when the stimuli are presented at 70 dB, we see a slightly smaller and later wave 5, and then at 60 dB, there's a questionable wave 5, and at 50 dB, it's really quite questionable whether a wave 5 exists. And so in this case, we would say the hearing threshold is 60 dB. That's the last point where we think that we might see a wave 5. This is the threshold recording for the right ear. And so again, in the top tracing, we see a 1, 3, and 5. And then as the stimulation intensity decreases, we'll notice that the 1 and 3 get smaller and smaller, and then the wave 5 also gets smaller and later. And in this ear, we can track the wave 5 getting smaller and later. It's well marked on the image until about 30 decibels. And by 20 decibels, the tracing is entirely flat. There is no wave 5. And so the hearing threshold here is a 30 dB. And so in summary, this hearing threshold on the right ear is consistent with the brainstem auditory evoked potential recordings that we just saw for this patient, where the recordings on the right ear looked better than they did on the left ear. And so we see that reflected in the thresholds, where the hearing threshold on the right ear is down to 30, which is close to normal, and on the left ear it was a much higher threshold. And so the interpretation for this patient is a hearing deficit on the left ear. Our last few cases show another use of the brainstem auditory evoked potential, and that is to look at brainstem function or brainstem dysfunction. This is a brainstem auditory evoked potential from a 2-year-old boy. There's a left ear recording and a right ear recording. And what is striking immediately is the size, the amplitude of the later waveforms, the wave 3, 4, and 5, compared to the wave 1. So in contrast to the previous cases that we looked at, where the wave 1 was very small compared to the wave 5, which suggested a sensory neural hearing loss, when we see a very small wave 5 compared to the wave 1, it suggests some sort of brainstem dysfunction. And so the recording for both of these ears, the best recording is at 90 decibels, as we see from the chart. And so the technologist has written a bunch of numbers in for us. And so we'll note that the wave 5 for both ears on the right ear has a question mark, because it's very hard to be confident that we're identifying the wave 5 even at 90 dB. And then on the left, the wave 5 is really not present. We're not very confident that we can identify it. And so when we look at the interpeak latencies, there's a clear and within normal limits 1.3 interpeak latency, but the 3.5 interpeak latency is not really calculable because we're not sure where the 5 is, and the 1.5 interpeak latency is also not calculable because of the absence of a 5. And so even if we trusted our wave 5 measurement, you'll note that on the right ear, the number is higher than the upper limits of normal. So the 2 points combined, this increased 3.5 interpeak latency, and then also the absence or very low amplitude of the later waves in both ears, would suggest some sort of upper brainstem dysfunction. This is the brainstem auditory evoked potential for a 12-month-old boy. And so we see a left ear recording and a right ear recording. The left ear is recorded at 70 decibels. The right ear is recorded at both 70 and 80 decibels. And this is because the 70 decibel recording is not as good. And so with the 80 decibel recording, we can see a clear 1, 3, and 5. Now, on both ears, we see clear 1, 3, and 5s, and so the technologist has written the numbers in for us at the bottom in the chart. And so looking across the absolute latencies, we'll note that all the absolute latencies are within normal limits, but what is abnormal is the interpeak latency, especially for the 1, 3 interpeak latency. And so we'll note that the upper limit of normal is 2.6, whereas in the right ear, it's recorded as 2.8, and in the left ear it's 2.7, both of which are higher than 2.6, whereas the 3 to 5 interpeak latency is within normal limits, and the 1.5 is also within upper limits of normal. And so the abnormality in this patient is in the 1.3 interpeak latency, which corresponds to a lower brainstem dysfunction. This is a brainstem auditory evoked potential in a 2-year-old boy. We see a left ear recording and a right ear recording, both of them conducted at 70 dB. For both ears, we notice very beautiful, technically beautiful recordings. They're clean, they're reproducible, the peaks are identifiable. And so in the left ear, we see a very nice peak 1, 3, and 5. And in the right ear, we see a very nice peak 1, 2, 3, and 5. And then when we look at our numbers, we'll notice that the waves 1, 2, and 3 are all within the upper limits of normal, whereas for both ears, the absolute latency of the wave 5 is high. It's higher than the upper limit of normal. And because this is at 70 dB, we can interpret this wave 5 as a real delay. And so we have a delay in the wave 5 of both ears. Going on to look at the interpeak latencies, we notice that the interpeak latency of the 1 to 3 is prolonged in the right ear, and it's also prolonged for the 1.5 in the right ear, whereas in the left ear, the 1.3 and the 1.5 are both at the upper limits of normal. And so taking all of this information together, we note that there's a delay of the wave 5, and then there's also a 1.3 interpeak latency delay in the right ear. And so this would suggest some sort of overall brainstem problem, and possibly more pronounced in the upper brainstem because of the delayed wave 5s.